Breast augmentation is one of the most popular procedures in plastic and reconstructive surgery today. Since its inception, the procedure has undergone tremendous change. The procedure has evolved from simply choosing an implant and stuffing the breast envelope with an implant to much more of a finesse operation that can yield incredibly natural results. Generally, in my practice, there are three types of patients that come in for breast augmentation surgery. The first type of patient is usually after a very natural result. They want more fullness in their breast, they're focused on improving their cleavage, but they want something that looks natural. For many of these patients, being able to deliver this result depends on being able to choose just the right implant to fit their breast borders. The second type of patient who comes into my practice typically is after a more full and enhanced look. These patients are often less concerned with whether people know they've had augmentation surgery. In these patients, it's extremely important to be careful in choosing the implant. Choosing an implant that far exceeds their borders will often lead to an unnatural result. Yet choosing an implant that's too small will lead to a result that they're not satisfied with. The third type of patient is after a very subtle result. These patients often want no one to know that they've had breast augmentation surgery. Many of these patients are moms who've lost a tremendous amount of volume after breastfeeding. In these patients, I often will offer both an anatomic style 410 implant, which has a much more natural shape at the top, as well as a small round implant. In doing this, these patients often are able to choose an implant that is well within the borders of their breast and will allow them to improve their shape without giving away the implant. My own personal technique of breast augmentation has evolved as a result of travel through a number of different places. After learning breast augmentation surgery at Harvard, I then traveled to 5 different countries to see how the operation was performed. I learned a tremendous deal about how to handle tissues and yield natural, long-lasting results. During the initial consultation, I spent a tremendous amount of time getting to know each and every patient. I get to know what their expectations are, what their goals are, sometimes what their fears are. I spend a tremendous amount of time explaining all of the different types of implants available, the different incisions used, and the different techniques that can be used to place the implant. Each and every patient is measured precisely in order to identify an implant that will meet their goals while yielding a natural result. Following this, we then use Vectra 3D analysis to image the patient and show them what they would look like with the implant that they've selected. Breast augmentation surgery is ideal for patients who are healthy with realistic expectations and realistic goals. The procedure takes about 1 hour to perform. It is done under general anesthetic, and almost every patient goes home the same day. Most patients will report a mild to moderate amount of pain for 1 to 2 days. Generally, after 1 week, most people are able to return to work. It's my pleasure to be able to offer the very best in breast augmentation surgery here in Charlotte.